So, welcome to Love Heals Cancer and ZenOnco.io. I'm Asta from ZenOnco.io. This is a cancer healing journey talks where we invite speakers who have gone through cancer, maybe as a patient, caregiver, or survivor. These CAJs are very close to our hearts because many patients tell us that when we listen to other people's journeys, it inspires them. It helps them boost their confidence and gives them hope that if others have been able to fight with the disease and beat the disease, then why can't they? So, thank you so much for joining us today for our cancer healing journey talks. And could you please introduce yourself and tell us how it all began?
Yes, thank you very much for letting me join in. So, my name is Aryan Dudwaani. I'm basically from Ranchi, Jharkhand, and all of this started in January last year. So, I was traveling to Tamil Nadu in December, and I used to have a bit of cough, bit more than a bit of cough after I returned due to the temperature differences. So, I had no clue as to why I'm not being able to stop coughing. So from December onwards, this was the usual affair. And then in January, I started exercising again. So there was this one day when I was jogging in the evening and I came back home and I was feeling uneasy around my chest. And I had an oximeter, luckily, because we bought it during COVID. So then I happened to check my heartbeat and it was really high, around 140 or something. So then I got a bit scared, and then we had my sister visiting us. So my sister told my father to take me to a hospital to get checked or something. And on the way, I had a heart attack in the car, and by the time I reached the hospital, I was in a pretty bad shape, and then they admitted me for like 2-3 hours or something, and then the pain and all it all subsided. They gave me painkillers for the same. So initially, I got admitted in that hospital itself for like 6-7 days, and the hospital honestly wasn't that good. So instead of doing the proper checkups, at least the routine ones, they insisted on giving me painkillers, which I knew nothing about. Was of the opinion that they are treating me for whatever I'm going through. It was around after 7 or 10 days when I realized that these guys are not very serious about affair. So I requested the doctor to discharge me. Luckily, I was being seen by a cardiologist. Luckily, on the last day of my this thing, when I was admitted in the hospital, what do you call it? Physiotherapist. No, not physiotherapist. The general physician, sorry. A general physician visited me and he recommended a chest X-ray for what I'm going through because the pain wasn't subsiding after the painkillers were dropped. So luckily I had that X-ray, and the doctors, they did not tell me what the report said. Instead, as requested, they discharged me. And the next day in the evening, I was discharged in the evening that day. And next day in the evening, I was I and my sister were going through the reports. And we were pretty happy as I've gone through it and successfully completed. So it had mention of, I don't know, some unusual thing. I don't remember the technical name of it. So some mass or something in the chest area. So we were really worried about it. And my sister rang up a friend of mine and she asked for advices as to what the report said. I asked a friend of mine, both were doctors. So they told me that it's looking bad right now. So then they told me that we should consult another doctor. And this particular another doctor, he told me to get a biopsy done for some reason. And then I went to Kolkata, got my biopsy done. Turned out it was cancer. Then I got admitted in Tata Medical Center in Kolkata. The treatment started in February first week, yeah, around 8 or 9. And I had in total 5 rounds of chemo. I had mediastinal yolk sac tumor. Uh, there was a big lump of tumor above my lung and between below my heart. So that's why the heart attack and all. And in total, 5 rounds of chemo and a surgery. But they cannot call it an open heart surgery. They just cut open the chest, they remove the tumor. So hopefully everything was all right. Everything is fine.
Right,
Yeah.
right. So, first of all, the thing that you highlighted, it is very important these days because we don't really know the exact doctors who are treating us, and the exact reports that we have. So it is very, very important to check out all the reports. It is a very important issue that you highlighted, that many doctors are like this. That I have also heard this, that many patients, like many survivors and patients, tell us that doctors were delaying the tests and all. They were saying that it is a minor issue or something like that. So yeah, even if there is a slight abnormality, you should definitely go to definitely seek out second opinions as well, so that it is clear whether the problem is anything else, or whether whatever the issue is. So right. Right. So, like, I wanted to ask, like, did you face any, side effects of the treatment that you were undergoing, and, how did you manage all those things?
Yes. So after the first round of chemo, I did not feel something very different, apart from feeling a little bit weak. From the second chemo onwards, my hair started falling. It was a very weird experience, to be honest. And then, obviously, the weakness was there. And then I lost taste after the second chemo. Uh, for some days, actually, my chemo used to take place at a 15-day difference. So for the first 7 to 10 days, I was in a very bad shape. Then for 2 3 days, I was feeling okayish again, and then I had another chemo and it was back to that. So yes, loss of taste, weakness, then loss of hunger. Then I wasn't able to. Uh, Actually, I wasn't able to excrete and all for days together, for which they gave medicine. And uh, what else? There were a lot of them, not a lot, there were like 6, 7 of them that took place. I'm not being able to remember right now. The loss of hair was there. And this was it. I had it, it wasn't that bad in my case. I've seen people go through worse.
Right. Mm.
Actually, my mother had cancer too. So she went through way worse than what I went. Maybe because I'm young, so I went through it properly.
Right, right, right. Like everybody's body is different, and also depends on the, type of cancer, or maybe the
So
stage of cancer, or, the type of treatment that you're taking, the type of chemotherapy. So it actually,
exactly,
right.
exactly.
Right. So, like, I wanted to ask, like, what all lifestyle changes did you undergo? Did you made any dietary changes, or, changes related to your physical activity or any other activities,
During or after the treatment?
both during the treatment as well, and even
Okay,
after the treatment, like right now, if you're
okay,
undergoing changes? Yeah.
okay. So during the treatment, I wasn't able to eat properly, so there wasn't much dietary anything as such. But I used to take in food at the very basic dishes like dalia, ya khichdi and all. So just so my stomach is not empty, because we cannot take a chemo in empty stomach. I fainted twice or thrice also post during the chemo in the hospital because of obviously weakness. So that was the only dietary change, and physical activity was a complete no-no during the chemo, obviously. And then post chemo, due to the surgery, actually I recovered from the chemo all right, better than I expected. And then post chemo, because I had that operation, so exercising is right now the doctors do not recommend it. But eventually I will start exercising. It's pretty normal. And as far as dietary changes are concerned, so there was this one uh, doctor. He was like, you've seen the Kabir Singh movie, right? Yeah, so this doctor was something of that sort. He was a surgeon and he was so smart, man. So he advised me. I was really scared before the surgery, post surgery too. So he told me this one thing: the best way to get through cancer is to live as life as normally as possible. So you do not have a physical or mental anything post the treatment. So as far as diet is concerned, he told me to tabak it or have everything as normally as you would have had if you had not had cancer. So no dietary changes. Yes, there are some physical restrictions, but that is because of the surgery, not because of the chemo. So, yeah.
Right, right. This is a very important thing. Like, no matter what all treatments you are undergoing or taking, the emotional wellness, the mental wellness is very, very important. Specifically, positivity plays a very important role during your treatment. If you stay
Absolutely.
positive, if you stay hopeful, and try to live your life as normally as you can. So it is very, very, plays a very important role during your treatment. So yeah,
Absolutely.
it is very, very important. Yeah, I had a question that, what were your major learnings from your entire journey, your major learnings that you would like to share with other people as well?
Absolutely. That is a good one. So I I run an organization, an NGO. I was basically interested in this particular field for a long time. I'm a law graduate, not a professional right now, but the social aspect was very interesting from when I started this particular organization. But then after this, all of this happened, this cancer thing. So I have a how do you say this, a rejuvenated sense of maybe some misplaced sense also of social service right now. So life is very short. This one teaching is what I got. Actually, I don't know if it's right to say this here or not, but there were a few patients that lost their lives in front of me. There were little kids who had pins right across their skull because their brains and their hands weren't able to take the meds anymore. So these uh, these incidents, these experiences, it's not even life is very short and should not be wasted, obviously. And people usually go after career and the monetary aspect of everything. Money will follow, obviously, but if you have some passion that can actually make you happy, follow that too in a limited sense if you want, and if not, if you can make a career out of it, all the more fun. But yeah, life is short and you need to live it as properly as possible according to your terms, not others.
Right, right. Thank you so much for, sharing these learnings are actually very much, valuable and, actually would, help a lot of people out there. So like I wanted to ask, yeah, so what message would you like to give to cancer patients as well as cancer caregivers?
Okay. There are three things I'd like to say. Firstly, for cancer patients, so look, earlier when people used to have cancer, people would be like, "नहीं, अब तो नहीं बचेगा, ये तो गया." So this is not the case anymore. The cancer technology is very advanced right now. Cancer is no more a deadly disease. No one is going to die. I myself had stage 4 cancer. I survived it only because of modern technology and good doctors. So as far as patients are concerned, the first thing that they do is panic, which is the worst thing that you can do when you have cancer. And second thing is delaying the treatment, which patients do. There was this one friend of mine who had cancer, tumor in his throat. If I'm not wrong, yeah, in his throat. So this guy went to a hospital and the doctors advised him, "नहीं कुछ नहीं है, go have a discipline and come back after 1 month, everything will be alright." But luckily his parents were doctors too. then they provided him the proper treatment. So yeah, the first treatment that you get post any symptom or post any serious attack or something, like in my case, the first treatment is very important. So take it seriously. Don't listen to any doctor. Doctors are not gods. They are people. They are professionals practicing their profession. Many of them are gods who are very serious about their profession, but most of them aren't. So don't listen to the doctor. Check your reports. We have Google today. You can have multiple number of searches and get the report in order. So don't. So basically, rely on yourself. Have confidence. Don't get scared. And as far as caregivers are concerned, I've seen one of the best treatments at Tata's. So I'd recommend that sort of caregiving to every hospital who's looking at cancer patients. This particular personal touch is very important because patients go through a lot of mental turbulence also during this physical journey. So I would advise that the nursing should be as perfected as possible, because these people are there with the patients 24/7, and as humble and as caring as they can be would be a very big booster for the patients to have. That's basically.
Right, right. Thank you so much for sharing these, messages, these, insightful messages. And I, totally agree with you, specifically with the point that you told that, many times people actually delay their treatments. And, even after knowing that, they have cancer or they have to undergo a specific surgery or chemotherapy, many patients are there who feel that, they think that there would be so many side effects of their treatment, but they don't understand that everybody, has different side effects. Many people are there who do not face so much side effects. So,
Exactly.
it is very important to,
There's,
everybody to understand.
sorry to cut in between. There's one
Yeah.
more last thing. As far as the monetary aspect is concerned, many people are scared because the monetary involvement is too high. So for that, I'd advise that there are many hospitals who are really good. Like Tata is one of them. I might not know about many. There might be many. And me myself, I was going through a very bad phase financially when I got to know about all of this. And I started a fundraiser. Fundraiser was very successful. And then I got funds from PM Care. So that was another. Okay, so as far as the finances are concerned, I'd like to advise everyone that the PM Cares Fund allows for a minimum of 2 or 3 lakhs of assistance to cancer patients, even for HIV/AIDS and other heart ailments and all. So you can always apply if you want to go through any treatment. And then there are CM funds in every state of India. So you can apply for that also. So financially, I don't think that you are off the mark. You can obviously get good treatment with all of these funds help. So financially also don't feel insecure. Yeah.
Right, right. Very true. There are many organizations that can help, and insurances and everything. Many things are there that can actually
Absolutely.
support you. So yeah, you should definitely go ahead with the treatment. It is a very nice message. Yeah, and I had one last question from you. If you would, if you could describe your entire journey in a single sentence, or if you want to, give a one-liner advice to anyone, like what would you suggest?
Okay, that's good. That's good. So I'd say uh, destination is not as important as the journey. Life is a journey. Live it as happily as possible.
Right, right. Such a wonderful message.
Thank
Yeah.
you.
So thank you so much for sharing your entire journey with us. It was actually, very inspirational and motivational. So, and I'm
Thank you.
sure that it would help so many patients, caregivers, and survivors out there. So thank you so much for sharing your experiences, for sharing
Absolutely.
your learnings. Yeah. So
Thank
thank
you
you
very
so
much.
much and take care and wishing you all
Yeah.
the best for all your future endeavors. Thank you so
Thank
much.
you very much. You.
Thank you. Thanks for your
Thank you.
time.